Following a childhood and early teenage years of 5 cancer diagnoses and surgeries, and a prognosis of advancing congestive heart failure, Kathryn Gallant entered a phase of life when her education and her career took center stage. Following her graduation from college, Kathryn became proficient in the world of marketing and consumer research, to the point that she became integral in the pharmaceutical industry and the development of advanced medications that have saved people's lives. And then, one day, Kathryn had trouble swallowing. Who are your clients?
My clients are pharmaceutical, biotech, life science, and healthcare companies all over the world.
And what are they trying to sell?
Usually when I'm working with them, they're trying to develop new products, new molecules, new medications, new devices, new treatment approaches, new diagnostic tests. They're trying to develop support programs for patients or healthcare providers using their products. The work I do now is usually fairly early stage, when the product is either not yet in human testing or is just coming out of the earliest stages of human testing. But the work I do is with all of the key stakeholders, we call them, in the conversation. So we work with physicians and other allied healthcare providers. We work with patients, families of patients, the worried well, people who might be at risk for certain kinds of diseases but don't actually have the disease yet. For example, pre-diabetic, but not actually have diabetes yet. People are living longer, healthy lives with disease that killed us like flies a generation ago. And I'm excited about that. I played a role in getting some of those drugs to market.
In playing that role, does it feel as if you're in some way making up for everything that you suffered, trying to help somebody else not feel the same way or go through the same things?
I feel like I'm paying back. I feel like I know people have it. Lots of people with lots of diseases have it easier now because of all these scientific advances. And I know I'm part of that. It makes me feel like all of that wasn't a waste.
So in bringing this whole story full circle and acknowledging the many issues that you might be answering within yourself over all the medical struggles you've had, a little over a year ago, what happened?
I knew that because of my thoracic radiation when I was a kid, my esophagus had been damaged because the radiation, this was what's called photon beam radiation, which isn't a precise kind of radiation. So we knew there had been what are called exit and entry doses. So the radiation sort of spreads from, they try to aim it as closely as possible at the tumor, but they know that it kind of goes out from there. And so we knew that my esophagus had been damaged. We knew that the valve between your esophagus and your stomach didn't always work perfectly. I had gastroreflux disease from early days. And we knew that my peristaltic action, peristalsis is that beautifully coordinated muscular flow that's all throughout your GI tract from the back of your mouth all the way straight through to the business end. That's the muscle, the automatic muscle motion that moves things through the full GI tract from top to bottom. We knew that in my esophagus, I occasionally had peristaltic failure where that would get disrupted or discontinued. Things would get stuck, and it would take a while for them to go down. But I was fine. I was able to eat normally. I didn't have any pain. In early summer of 2015, I was traveling, working, and I noticed every once in a while I'd be eating and things would get really stuck, way stuck, like in my esophagus. And I would, your body is really finely attuned. If something's stuck in your esophagus or your trachea, your body goes right to work getting it out. And so this was so bad I couldn't swallow it down. It would come up. Later that summer, I called my doctor and made an appointment. The weekend before I was supposed to go see her, I ate something, a piece of chicken, and it immediately got stuck in my throat. And I'm like, okay, it's stuck, something stuck. I go to drink water, which usually helps. The water gets stuck. It won't go down, and it won't come up. So I can breathe. I know it's not in my trachea, but the pain is immense. And your body goes into panic mode. Fear. And so my husband was right outside the door in the backyard. I, called him. I could make noise. and he came in and he gave me the Heimlich. A little bit came up and I was still in agony, and so he put me in the car, drove me right to the emergency room at the University of Rochester. They immediately started an IV, and they gave me an antiemetic, which is an anti-vomiting medicine. They said, we don't want you vomiting because we're afraid things will get stuck and it'll get into your trachea and then you'll aspirate and die, suffocate. And the minute the medicine, the antiemetic, went into the IV, I threw up.
But they were supposed to... Okay, never mind.
Paradoxical response, that's what that's called. And I got most of it up. So they admitted me to the hospital, and I wasn't allowed to eat any food or drink anything. They basically needed to do a GI scope to figure out what was going to happen. But I'm complicated, and they were disorganized, and I had to raise my voice a few times and have difficult conversations with a few people.
Because
they weren't making a plan. And so I was just sitting in the hospital, and I said, on Tuesday, I said, do we have a plan for today? And they said, well, we're hoping to have one by the end of the day. And so I got out of bed, I stood up, and I started packing my bag. And it was a gastro fellow was there, and she said, where are you going? I said, I'm going home. I said, I can not eat and drink at home. I'm not staying here. And so then things started to move. So I had the scope that day, and they said, if it's a stricture, we'll go in and we'll dilate it. If we see it, we'll do it in the same procedure. And so they did the procedure, and I woke up, and it wasn't a stricture. It was a really big tumor in the middle of my esophagus. And the story that evening is, you're going to die. You're not going to be a surgical candidate. You're not going to be a radiation candidate. It's squamous cell carcinoma. There are two kinds of cancers usually found in the esophagus. I know squamous cell carcinomas can be found throughout the body, often in the GI tract, but I don't know anything about the histology of them or how they're treated or anything. That first day was really bad. And I had the surgery team come and go, we're not going to be able to do anything. You have cardiac issues. So I woke up the next morning and I called Steve Sallin at Dana-Farber, who had treated me as a child.
He was still there?
He's the chief of staff emeritus, and he and I had stayed in touch. He was the first person I called on my 50th birthday, the morning of my 50th birthday.
Why did you call him on your 50th birthday?
Because I was 50.
And you made it, right?
And I knew he'd want to know, and he was so grateful. It was just, I thought, if anybody understands this, he will. He was really happy to hear from me. He doesn't know anything really about adult cancers. He's a pediatrics guy. He doesn't treat that. I knew he wasn't going to be my doctor. But, man, within an hour, he had an appointment set for me with the chief of GI radiation oncology, the chief of GI medical oncology, and the chief of thoracics at Dana-Farber. And it became pretty clear to me that there were options if I wanted to delay time to progression, and there were options if I wanted to shoot for a cure. The minute I knew there was a potential curative option, I wanted that. I had to move to Boston for almost 2 months for proton. We did decide to do proton beam radiation. It's essentially a more advanced form of radiation that doesn't have it has a tiny, tiny entry dose and no exit dose. They get where they're going and they just do their work there. They don't spread out at all. So I had my chemo at Mass General and my proton beam all at the same time. And then the plan was that they would use the chemo and the radiation to debulk the tumor. And about 6 to 8 weeks after that, Dr. Swanson would do a less invasive esophagectomy, which meant that they would remove my entire esophagus and some of the tissue around where the tumor had been, and that they would then take my stomach and pull my stomach up through my diaphragm all the way up my chest and reattach it at the top. And my stomach would become, I don't have an esophagus now, I have what's called a conduit. And my stomach now acts as and keeping in mind what I said earlier, peristalsis is throughout your GI, so the basic function of the muscle works the same way as your esophagus works. Food goes in and the muscles start to work to push it down and through the system. So that's what I have. And I don't have a valve anymore. So you have a valve between your esophagus and stomach that once food goes into your stomach, the valve closes and it's supposed to stay there. I don't have that anymore. So I can't eat too soon before I go to bed or lay down or anything like that.
Because
the food comes right up. People live long, normal lives with esophagectomies. I mean, I'm not unusual. I went back to work within, 6 weeks, less than 6 weeks of the surgery.